Well, hi everyone. Thank you for joining us today. My name is Amanda Biggis, and I am part of the Senior Linkage Line team at Metropolitan Area Agency on Aging. I am joined today by Kirsch Cooks and John Ward, who are also a part of our team here at the Senior Linkage Line. Today we will be discussing Medicare. Before we dive in, I want to give you a little information about the Senior Linkage Line and how we can help. The Senior Linkage Line is a statewide service of the Minnesota Board of Aging. We are housed within 6 area agencies on aging across the state. Those 6 contact centers cover all 87 counties in Minnesota. Our experts on the line are trained in health insurance counseling, long-term care options counseling, and many more. The Senior Linkage Line does not sell, market, promote, or endorse any insurance products. So when you call the Senior Linkage Line, you can be sure that you're going to get that non-biased, objective information and assistance. We are Minnesota State Health Insurance Assistance Program, also known as SHIP. So again, the people that you call on the Senior Linkage Line are trained in Medicare and long-term care options counseling. We are also what's known as Minnesota's Senior Medicare Patrol. And that means that we are also trained to fight healthcare fraud, waste, and abuse. So if you feel that you've been a victim of fraud, you can call the Senior Linkage Line and we can help you know where to start. We are also Minnesota's Aging and Disability Resource Center. We can provide resources and assistance to remain in the community. Now, I mentioned before that we have many areas of expertise. I highlighted Medicare and long-term care options counseling or planning, but there's many other things that we can help with as well. We help with care transitions, prescription drug expense assistance for people of all ages, not just older adults. We offer application and forms assistance. Our experts on the line will sit with you and help you fill out those forms and applications. We offer caregiver planning and support. It's very important if you are a caregiver of an older adult that you also get the resources and assistance that you need. Again, healthcare fraud, waste and abuse, state volunteer opportunities, and just any general agency-related questions. I always say that if you're not sure if the Senior Linkage Line can answer a question for you, you should call us, and chances are we can help or point you in the right direction. So since 1993, the Senior Linkage Line has provided statewide comprehensive information and assistance. Again, it's from the Minnesota Board on Aging, and we are housed in the 6 area agencies on aging. This map here shows you where we are located throughout the state. So we have offices in Warren, Duluth, St. Cloud, Arden Hills, Slayton and Mankato, and Rochester. I like to point out that no matter where you talk to somebody in the state, you're going to get that same non-biased, objective information. All of our Senior Linkage Lines have the expertise no matter where they are in the state. We try to route you to the closest office to you, but for example, if there is a lot of people on the line and we have to route you to a different office in the state, you're going to get that same help and information no matter who you talk to. So Minnesota Healthcare Choices is a resource that we always like to highlight. It's a booklet that provides comprehensive information on all Medicare options in Minnesota. A new booklet comes out every year. The best way to access this resource is to view or download a copy at minnesotahealthcarechoices.com. So now we will begin with a little overview of Medicare. Medicare is federal health insurance that began in 1965. It's for people age 65 or older, but also people who are under age 65 with certain disabilities can be eligible as well. You become eligible after you are on Social Security disability insurance for a period of 24 months. People with ALS, which is also known as Lou Gehrig's disease, are eligible for Medicare without that 24-month waiting period. And then any age with end-stage renal disease, you are eligible for Medicare as well. Medicare was never intended to cover 100% of medical expenses or long-term care services. It was always intended to be combined with other things such as retirement savings, Social Security, or other assistance programs, which we will discuss in further slides on the presentation. So this is an example of the Medicare card. You receive this card from Social Security, and you have the option to sign it and send it back if you do not want Part B of Medicare. We will discuss why you may or may not want to sign up for Part B when you become eligible in coming slides. You want to keep this card in a safe place. Treat it like your Social Security card. Only take it with you when you need it for appointments. But otherwise, don't carry it with you. Keep it at home. This card is only for Medicare Part A and Part B. If you enroll in Part C and Part D, you will be issued a separate card. And this does not replace your Social Security card, so don't destroy your Social Security card once you get this Medicare card. This card, up until very recently, used to have your Social Security number on it, but now they've replaced that with what's called the Medicare Beneficiary Identifier, or an MBI. It's a series of letters and numbers that is unique to you. So again, it does not replace that Social Security card. It's a new card in addition. If you need a replacement for your Medicare card, you can log on to your Medicare or Social Security accounts and request a new card. So Medicare is made up of 4 main parts. We have Part A. Part A helps pay for inpatient hospital stays and also helps cover skilled nursing care, home health care, and hospice care. Part B helps cover medically necessary services like doctor visits and outpatient care. It also helps cover some preventative services, including screening tests and shots, diagnostic tests, some therapies, and durable medical equipment. Part A and Part B together are what's referred to as Original Medicare. Part C is another way to get Medicare benefits. It combines Parts A and B and sometimes Part D. These are private insurance companies that are approved by Medicare. They must cover medically necessary services. However, plans can charge different copayments, coinsurance, or deductibles for these services. And then we have Part D. Part D is Medicare drug coverage that helps pay for outpatient prescription drugs. So now that you have had a brief overview of what Medicare is, I'm going to turn it over to Kirsch to go into a little more detail.
Thank you, Amanda. Okay, well, welcome. We are going to continue. So where I'm going to start at is talking a little bit more of the Medicare coverage options. For example, we're going to keep in mind that this is all regarding Original Medicare. So for when it comes to option number 1 for Original Medicare, you have the Part A. As Amanda mentioned, it's the hospital insurance. And then you have the Medicare Part B, which is your medical insurance. But there are some options of what you can connect with your Original Medicare. Many times it can be very helpful just to have a little bit of extra coverage, just to pick up the pieces of what Medicare does not cover. And so what we have here is we have the optional coverage, and that is a Medigap policy, and that pays the out-of-pocket cost of Medicare approved services depending on the policy that you select. Then we also have the Medicare Part D, which would provide that drug coverage from the pharmacies, things such as those. Medicare Part B, it does have some limited coverage for medications if you're going into a doctor's office, such as an infusion and things such as that. But if you're going to a pharmacy or mail order, it would definitely be falling under a Medicare Part D. So that would definitely be an option to consider if that is something that you would like to have for extra coverage for your medications. Then we are moving into the Medicare coverages for another option. Now, these are the Medicare health plans. These are through private insurance companies that are approved through Medicare. And the first plan we have here is going to be the Medicare Advantage plan. This plan will provide coverage for Medicare Part A, Medicare Part B, Medicare Part D, and there may also be some extra coverage and benefits depending on the plan. Starting this year, there was indefinite benefit where you can, depending on your needs, you may have been able to get some additional services depending on that Advantage plan. Then we have what's called the Medicare Cost Plan. The Medicare Cost Plan, that combines your Part A, your Part B, and also have an option for combining your Part D, and along with that, some additional benefits. What I would also like to know for the differences between the Medicare Advantage plan and the Medicare Cost Plan are, when it comes to the Medicare Advantage plan, many of the plans do have the drug coverage connected, and there are a few that do not. But even if you do come across a plan that does not show to have the drug coverage connected, you are not allowed to add on a second drug coverage plan to combine with your Medicare Advantage plan. So if drug coverage is something that you really would need to use, you will want to make sure that you're finding a plan that is right for you. Because if you were to enroll into a Part D plan after enrolling into a Medicare Advantage plan, the bad news is that it actually would cancel out that Advantage plan. But when you have the Medicare Cost Plan, there are plans that actually include the Part D for your drug coverage, and then there are plans that do not. And for the plans that do not have the drug coverage, there's actually another benefit for some people where you can have a separate drug plan with the Medicare Cost Plan. Another difference would be when you get an Advantage plan, they take over all your Medicare needs. If you have any questions or concerns, instead of going through your original Medicare, like contacting the main number, you would actually contact your health plan. So if you were planning on traveling, you will want to find out if this is something that has access to a network for you. So these are some different types of things to consider. But when you have the Medicare Cost Plan, you do have that option of still connecting with your original Medicare for certain inquiries. And if you are so happen to be a snowbird, if you were to leave out of the state of, we're speaking of Minnesota, you would still have your original Medicare plan to fall back on. So these are just some important things to think about when you're wondering about which plan would be right for you, or even if a plan is needed, or if you're going to remain with your original Medicare. All perfect reasons to give us a call at Senior Linkage Line. When trying to figure out about enrolling in Medicare, there are some important questions to consider. Wondering if you have insurance through a current employer is going to be a very vital question to think about. If you do have insurance coverage that is considered creditable, for example, if you're working for a place or your spouse is employed someplace that has 20 plus employees, there's a great chance that you will not be faced with a premium penalty if you decide to wait to enroll into your Medicare plan. So there's also a special enrollment period if you do have creditable coverage and you decide to delay your Medicare coverage, and that is the 8th month. So following that last month of employment or coverage of the health plan that's considered creditable, So whichever comes first. So many reasons to consider why you'll want to wait for enrollment. And another one to consider is, do you really want to pay a penalty if you don't need to? And that may mean that you can hold off because you have that creditable coverage. Or do you want to have that Part B and have to pay an additional premium if you do currently have creditable coverage? Another thing to think about is, as soon as your Part B Medicare begins, you have what's called a 6-month window that we will talk about in another slide for getting into a Medigap policy. So there's the 6-month window where you have what's called guaranteed issue rights, where your health condition does not matter in a decision. You are automatically able to enroll as long as you enroll within the first 6 months of your Medicare Part B. Again, this is something that we will be talking about a little further in another slide. So when we think about group health insurance and Medicare enrollment, important things to think about and talk about. So if you've been putting money into your health savings account, also called an HSA, it is important for you to know that you would need to stop those payments before any Medicare or Social Security benefits begin. Health savings accounts, which I will refer to again as HSAs, they are tax exempt. Then those accounts in which people do contribute their pre-tax dollars through their place of employment, they are used to pay for those important medical expenses as health insurance deductibles. So insurance revenue services prohibit Medicare recipients from continuing to contribute. If you do continue to contribute while on Medicare, you may face some stiff tax penalties, so you really want to be careful. If you continue to do so while on Medicare, you really want to make sure that you do some checking just to make sure that you're not faced with any huge costs in the long run. But if you can know, you can continue to actually draw the money left in that HSA account after enrolling in your Medicare plan or just original Medicare or going on Social Security. So just know the premium-free Part A, it is backdated 6 months from the date that you apply for your Medicare or your Social Security benefits. So the Center for Medicare Assistance and Medicaid Services wants you to just know that you need to stop contributing to that health savings account at least 6 months before you apply. Again, that can result in stiff tax penalties. But you can use, again, those HSA funds they can use for paying for your Medicare Part B premiums, Medicare Advantage plan premiums, your Part D plan premiums, even long-term care insurance expenses, such as those co-pays and deductibles. But also note, the HSA cannot be used to pay for a Medigap premium. And also an important part to note when it comes to group health insurance, Medicare, and COBRA. COBRA prescription drug coverage, it may qualify as creditable for prescriptions, but you would need to find from your employer if it is creditable. And also know that COBRA, it does not count as employer health insurance coverage and would result in a Part B premium penalty. So what you would need to do is complete the form CMS 40B for boy, which is the application for enrollment in Medicare, and have employer complete theirs, which is the CMS L564. And this one is the request for employment information. When we talk about Medicare enrollment periods, we're going to break it into sections. For example, we have the initial enrollment period, and we also will refer to that as IEP. And then your initial enrollment period is for those that are 65 and older, and they have 7 months, 3 months before their 65th birthday, the month of their 65th birthday, and 3 months after their 65th birthday to enroll. And for those that are under age 65 and they are a person with a disability, theirs is after collecting Social Security benefits, their Social Security disability insurance benefits for 24 months. So when a person is determined to be eligible for Social Security disability insurance, there is a 5-month waiting period before they begin to collect their Social Security disability insurance benefits. So initial enrollment period, it is 3 months before the 25th month of the disability, the 25th month of their disability, and then 3 months after that 25th month. Then let's shift over into the general enrollment period. In a general enrollment period, this is for January 1st through March 31st, and this is annually. Then we have the open enrollment period, which is also annually, and that's October 15th through December 7th. Then we also have what's called the special enrollment period, also called SEP, and there are certain circumstances that qualify a beneficiary for an opportunity to make these changes. Then we have the Medicare Advantage enrollment period of January 1st through March 31st. These, of course, are definitely some important dates to remember, and don't worry, we are going to definitely address the benefits of each one of those periods for you. Starting with the initial enrollment period, also called the IEP. So when someone is first eligible for Medicare, they have what's called the initial enrollment period. This is that 7-month window, 7-month period where they start the 3 months prior to their 65th birthday, and then they have the birth month of their 65th birthday, and then it extends 3 months after. But it is very important to know for during this enrollment time, anyone who do not enroll during this initial enrollment period, there may be a possibility of having those late enrollment penalties and be without the coverage you really may need. So beneficiaries who are eligible for a premium-free Medicare Part A, they can enroll in their Part A anytime after their initial enrollment period begins without a penalty. However, beneficiaries can only enroll in their Medicare Part B and Medicare Part A during their initial enrollment period and other limited times. If a beneficiary did sign up for their Medicare Part A and or Medicare Part B during the first 3 months of their initial enrollment period, their coverage date will depend on their birthday. So for Medicare Part B, coverage starts the first day of their birthday month, or if your birthday happens to fall on the first of the month, then you can expect for your coverage to start the first day of the previous month of your birthday. So if someone is enrolling in the Medicare Part A and or their Medicare Part B, the month that they are turning 65, or if the beneficiary does turn there, the last 3 months of their initial enrollment period is their start date, which can actually be delayed. So coverage begins the first day of that month. The month following the month of enrollment, if enrollment occurs during the 4th month of their initial enrollment period, the month you turn 65. Then we have the 2nd month following the month of your enrollment, if enrollment occurs during the 5th month of the initial enrollment period, or the 3rd month following the month of enrollment if enrollment occurs during the 6th or 7th month of the initial enrollment period. Someone can choose whether or not to enroll in their Part B. However, again, there may be a premium penalty if they do not enroll during their initial enrollment period. For someone who does not enroll, will pay the monthly premium. For someone who do enroll, there will be a monthly premium for their Medicare Part B. So thinking about the initial enrollment period when it comes to someone that has disabilities. Eligibility for Social Security Disability Insurance, which I will also refer to as SSDI. Usually the date the disability began plus 5 months, due to the 5-month waiting period for the SSDI. It is 24 months from the date when Medicare should begin. Beneficiaries on Medicare due to their disability can go on Medicare before a 24-month waiting period if they have ALS or end-stage renal disease, which is called also ESRD. So ESRD begins collecting their Medicare benefits generally 3 months after a course of regular dialysis begins or after a kidney transplant. ALS gets Medicare immediately upon collecting their Social Security disability benefits. For individuals who become Medicare eligible because of their disability, their initial enrollment period is 7 months, period surrounding their 25th month that they begin receiving their Social Security disability payments. At this point, they are automatically enrolled in their Medicare Part A, and they must either accept or reject their Medicare Part B. Part B penalties can apply for those that are under 65 until they are 65, and then that penalty will end. So if you become eligible for your Medicare benefits because of a disability, and you have been receiving your Social Security disability insurance through even a railroad disability and annuity check for 24 months, you should automatically be enrolled as well in both your Medicare Part A and your Medicare Part B at the start of your 25th month. You should not have to contact anyone. You should receive everything in the package in the mail 3 months before your coverage will start, along with your new Medicare card. There will also be a letter explaining how before your coverage starts and what to do with your new Medicare card. There will also be a letter explaining how Medicare works and that you were automatically enrolled in both Part A and Part B. If you get Social Security retirement benefits, your package and card will come from Social Security Administration. And if you do get benefits through your railroad disability annuity checks, your package and card will actually be coming directly from the Railroad Retirement Board. Then we have the General Enrollment Period, again, also called the GEP. So for someone that has Social Security disability insurance who does not enroll in their Part B, will in most situations have a Part B premium penalty, but it will end when they turn 65. If a period of time having the Part B is less than 12 months, just also know that it is just for that 12-month period. So if there was, say, 23 months, then that penalty actually would still only be the 10% for the first 12 months. So when someone is considering and needing to enroll into their general enrollment period, the difference with this would be when you enroll during the January through March, you can expect your coverage to begin July 1st. So another reason when you are doing the general enrollment period, it is when you have declined that Part B during that initial enrollment period, or have canceled your Medicare Part B without having any other insurance, or you did not enroll in your Medicare Part B within that 8 months of current employer coverage or union coverage ending. So when your time comes and you really have to make some important decisions about if you need to enroll or not, these are some very important things to consider, just to make sure that you feel as prepared as possible. Medicare comes with many important decisions, such as when to enroll, and I just gave some different dates for you, and some of those dates may come with a penalty if you are not enrolled in time. And also how to get those Medicare benefits. And thinking about that Medigap coverage, is that going to be something for you? Is it going to be a benefit? And again, that guaranteed issue period. Also, are you going to need Medicare Part D prescription drug coverage? And just considering those important factors of what can come with having a Medicare Part D plan or going without. And also the annual review of coverage. So when thinking about Medicare, these are definitely all some very important pieces to think about. Starting with original Medicare Part A, which is for inpatient hospital stay, not observation status. And there's also a 190-day lifetime maximum for a psychiatric hospital. The original Medicare Part A also covers skilled nursing facility care if it is for if you are during a qualifying stay. For example, if you are an inpatient for 3 midnights and you are determined to need additional care in a nursing facility, then again, that would be something that can fall under the coverage for your Medicare Part A for original. Then it also can help with home health care, hospice, and blood coverage. So I'm going to be handing it over to John, and he'll be able to go into a little bit more depth regarding the coverage and the original Medicare cost.
Thank you, Kirsch. We're going to take a look at the cost for Medicare A and B, and these will be primarily what your costs would be. So Part A hospital deductible this year, and this changes every year, is $1,408. Now that is for a 60-day benefit period, which means that if you enter a hospital and you are in there and admitted to the hospital, again, not for observation, but you are admitted, then you are responsible, you or possibly your additional insurance are responsible for the $1,408. But it does cover 60 days. So that means that if within that period of time you are readmitted to the hospital after you've been released, you may not have to pay an additional deductible. Once you are in the hospital for 61 days, and of course, then it goes up. Your 61st day through the 90th day is $352. Your 91st day through the 150th day is $704 a day. Now, these are your costs, your individual costs. A skilled nursing facility for a period of time for days 21 through 20, and this is if you are admitted to the hospital, you're there, as Kurt said, for 3 midnights, then you go to a skilled nursing home facility for rehabilitation. Medicare will pay for that for up to 20 days. After that, from 21 days to 100 days, your cost will be $176 a day. Medicare will, of course, pay the rest of the cost. Home health care, there are no costs to you. Hospice services, there is no cost to you, but there may be a $5 copay for each prescription drug if pain relief is involved, and $5 coinsurance for respite care. Blood, you pay for the first 3 pints unless you are a member of a blood bank or someone donates the blood on your behalf. Part B. Now, Part B is the physician services. And this probably will be the bulk of the type of services that a Medicare recipient would get. Outpatient hospital service, which include observation, which would include same-day surgery, which does include some preventative services. It does include part of the cost of ambulance. It does include home health care. We'll talk about what parts those are of the cost in a little bit. Therapy, occupational speech, physical therapy, and there are some limited prescription drugs involved with Part B. Those are normally drugs that are infused in a doctor's office or in a clinical setting. For example, I have macular degeneration, and when I receive a shot in my eye for the macular degeneration, that falls under Medicare B. Then blood and lab services and durable medical equipment. And durable medical equipment are things that are ordered by the doctor that may be necessary. They would include oxygen equipment, would include possibly wheelchairs, that type of thing, including things like braces that may be ordered for knee surgery as an example, plus prosthesis, orthotics, and some supplies. And again, we'll talk a little bit about the cost. Acupuncture is new in 2020 for the lower back. So if you have lower back issues and acupuncture works, original Medicare B will be covering that. So now we want to talk next about some outpatient services that require prior authorization. Because of all of the requests for these services, beginning in January, just recently in January of this year, Medicare began requiring certain outpatient procedures to have prior approval. Services include blepharoplasty, botulinum toxin injections, panniculectomy, rhinoplasty, and vein ablation. And those will require prior authorization before Medicare will cover any of those costs. Now this year, the cost sharing. This would be the cost sharing for a Medicare recipient. You have a monthly premium of $144.60 for most of us. Now that $144.60 is always a premium cost, even if you have additional insurance. So I've always cautioned people that I've talked to that remember when you're adding up your premium cost to put that on top of the list and then add the other costs for your additional insurance premiums and possibly your Medicare D premium. This year, the annual deductible is $198. That means that you are responsible for the first $198 of your doctor. If you go in the doctor, very often that would cover at least part of your first doctor office visit. And after that annual deductible, most services are covered at 20%. Again, as was mentioned in the beginning, Medicare is not necessarily cover everything. It covers 20% of any of the doctor and clinical related items. Preventative services. Now, there are many preventative services like colonoscopies and mammograms that now have no cost sharing as long as they're doctor ordered. And again, acupuncture. We talked about that a little bit. Ambulance is a 20% co-insurance that may or may not be supplemented by additional insurance. Durable medical equipment is 20% co-insurance. And a little bit of a sort of a warning here with regard to durable medical equipment. If you go into the hospital, for example, for knee surgery, and there is a knee brace involved, Medicare may only allow that knee brace to be paid for a certain length of time, and then you would have to pay the full price. So you have to be aware of that there are certain Medicare rules related to durable medical equipment. Home health care, there is no cost. Therapies are 20% coinsurance. And again, those limited prescription drugs, like the one that I mentioned that I have, are 20% coinsurance. And your cost would be, if blood is necessary, the first 3 pints of that blood. Now let's talk about what's not covered by original Medicare. Comprehensive annual physical. It may be covered by a Medicare Advantage plan, but it is not covered by original Medicare. There is what's called a wellness exam, an annual wellness exam that is covered by Medicare. And that annual wellness exam, I just recently had my yearly annual wellness exam, involves the doctor checks the heart and the lungs and blood pressure and covers most of that. And then they ask you a series of questions regarding how you're feeling, what your home life is like, etc. Hearing aids. Hearing aids are not covered by original Medicare. Many of the insurances, especially the Advantage plans, will cover some of that cost. Dental services are not covered by Medicare. Medicare says in their website that they will cover really major operations if major operations are necessary in the hospitals. Routine eye exams are not covered. I mentioned my eye problem, and that is covered. The eye exams there are covered by Medicare, but routine annual exams are not covered, and eyeglasses are not covered. Many additional insurances have some discounts or coverage for that. Most care while traveling out of the United States is not covered by original Medicare. Some insurances will cover travel outside of the United States. And custodial care, long-term care. You can be in the nursing home or in an assisted living or rehab center for that period of 20 days without any cost. But if you are live, if that becomes your permanent residence, then Medicare doesn't pay anything unless a doctor is called in or you require some sort of medical assistance. And routine foot care is not included in Medicare. Now we'll talk about Medigap policies. Now, Medigap policies help to cover original, and I emphasize the word help to cover, original Part A and B, the co-pays and the deductibles. They are sold by individual insurance companies. I like to equate that to the sale of house and household insurance or auto insurance. They are sold by them and they vary in cost. You can have the same type of a plan for one cost by one insurance company, and another insurance company may possibly charge a different amount. They are standardized. Again, there are differences in premium costs, and there may be differences in the level of customer service. 6 months guaranteed issue period following your initial enrollment in Medicare B. That means that is really now the only time, that initial enrollment in Medicare B, up to 6 months, that you can enroll in a Medigap policy without underwriting, which means very much like a life insurance policy where you may have to undergo a physical or they may deny you because of pre-existing conditions. However, up until that point, you can enroll in a Medicare B plan without any concern about pre-existing condition. They are transportable to other states where premiums may be higher. There was actually an employee of the Metropolitan Area on Aging who moved to a different state to take care of her mother, and she took her plan, her Medigap plan, with her, and it seemed to work for her. Minnesota is what's called a waiver state. There are no alpha options. And all that simply means is that the options do not have an alphabet letter assigned to them. Now, the plans are basic with riders, extended basic, Medicare Select, and a few of what are called the alpha policies, but again, they are designated by their name. And there are additional mandated benefits that would be included, and those may be national benefits, and there may be some state benefits that may be included. So I want to take a little bit more in-depth look at Medigap policies in Minnesota. The basic with riders means that it covers primarily the co-pays. It'll take care of the 20% that Medicare does not pay. There are normally in a full basic with riders, no co-pays for doctors and other clinical services. The extended basic includes riders for that $1,408 that I had mentioned that goes along with Medicare A, the deductible that's included in that. And there may be some other basic, extended basic riders, which now only would include things like a preventative rider, because there is no extended basic rider for Medicare B deductible. Additional plans with limited coverage. Now, there are some plans that have a 50% coverage, a 75% coverage, and there are some plans that have the Part A deductible coverage, but only not full. That would be what would fall under the extended basic, only not full coverage, but they cover 50% of it. And there are some with what we had normally determined probably as co-pays of $20 and $50. And they're similar to the numbered plans that show there. And then there's a high deductible plan in which you pay the cost in the beginning, and then the plan comes into play, and that will cover everything. Medicare Select is a plan that you can take with you. It is the same, follows the same rules and guidelines as a Medigap policy. However, the Medicare Select does have a network. Now, the one plan that comes to mind as the example is the Medicare Select Plan, Blue Cross Blue Shield, Senior Gold, which has been around a long time. And that will cover all of the things that the Medigap policy covers, just using the Blue Cross Blue Shield network, of which there is one in every state. Retiree supplement coverage. I only want to say one thing about that. If you are retired and you are getting supplemental coverage from the federal government or state and local governments or the company that you worked for, that you can continue to do that as long as obviously the coverage for your prescription drug is creditable and as long as you are comfortable with that particular plan. For most of those types of plans, once you leave them, if you decide to leave them at some point, you cannot go back to that type of plan. And I always caution people, if they have that plan, to look at plans outside of the retiree plan in case you might find something that may work better for you. Medicare Part C Advantage plans are offered by Medicare-approved private insurance companies. They have to follow the Medicare rules, all the Medicare rules, and they must provide at a minimum Medicare services. It's another way to get the original Medicare benefits A, B, and D. They are the only payer of Medicare bills, and original Medicare does not pay. Now, for example, with some of the other plans, original Medicare would be the primary payer, they would be the secondary payer. In this case, they pay all of the bills and they do their accounting through Medicare. But keep in mind, as I said earlier, that you will have a premium for these plans, although some may come with a zero premium, but you still have to consider the $144.90 a month or whatever the monthly premium you are paying for Medicare B. You need to use the provider's networks, and you cannot have a Medigap policy. We'll talk a little bit more about that as we go along here. Types of Advantage plans in Minnesota in 2020. Health maintenance, HMO, that means that you will be required to go to their network. Doesn't mean necessarily that you have to go, that there is always just one building that you go to, but their network to get the service, to get the full benefit from the plan. There's also what's called a health maintenance organization with point of service, which means you can go outside of the network, but you may be paying a little more. Then we have the preferred provider organization, where you pay less, again, if you go to the network provider, but you can use any provider, but it will be out-of-pocket costs will be higher for you. You may pay the full 20%, or you would pay higher costs. Then what's called a private fee for service. That means that you go to the doctor and you say, I want to know if you will accept this plan. And if the doctor accepts the plan, then the doctor also contracts for whatever the plan will pay. And your costs then would be whatever your copays may be. Now, looking at a newer type of plan, Advantage plan, and one that does not include a Medicare D. The plans above, the ones that we just mentioned, do include Medicare D for most people, and the Medicare Advantage medical savings account does not. Now, the Medicare Advantage medical savings account is high deductible. It is a plan that includes a medical savings account, similar to a health service account. In looking at that, if you are interested in this, I would recommend exploring how that works in order to make sure that you fully understand it. Special needs plans are designed for people who are called dual eligible, and that means that you would be receiving assistance from the state government, usually through the state, usually for your medical costs. And the plan is, again, the only payer of service, but there again, it is for people with special needs who have additional services through the state. I'm going to talk now about the Advantage in Medicare Part D, open enrollment period. It's coming up, October 15th to December 7th. Now, as we go through from October 15th to December 7th, during that period of time, you will have the option of being able to review any of the Advantage plans you may have and your Part D, your prescription drug plan. And again, most Advantage plans include Part D. I do want to mention, just so that you understand, that there are some people who may be able to get may not need to get a Part D plan and still have creditable coverage. And those are people primarily that can get their prescription drugs through the, excuse me, through the Veterans Administration. The Part D penalty, if there is no creditable coverage for 63 or more consecutive days, you may pay a penalty. Now this year, the penalty is always 1% of an average premium for a Part D plan. This year, it's about $32.70, and that's the national average that they go by. That 1% is added to your premium and becomes part of your premium for the entire time that you are purchasing a Part D plan. So you want to keep that in mind, that there is that penalty. And the open enrollment plan, there is a new Advantage open enrollment plan, Medicare Advantage. Now, if you have a plan, and we'll take this as an example, if you have a plan, a Medicare Advantage plan that you decided on, you come to January or end of December and you say, I think I made a mistake. I think I found a better plan, or something that I don't want. Or I don't want an Advantage plan. I want to go back to original Medicare, A and B, and just get a prescription drug plan. You can do that in January, February, and March. Keep in mind that if you do that and enroll in a new plan, but you already have to be in an Advantage plan. So that's the crux of it there. You have to be in an Advantage plan. So if you enroll in January, then your plan begins February 1st. You enroll in February, your new plan would begin March 1st. And if you enroll in March, your plan would begin April 1st. And this is something relatively new in the last couple of years. I want to talk a little bit about cost plans. Now, it's not a Medicare Advantage plan. There is no lockup. In 2019, it ended for most counties in Minnesota due to a law change in federal law that had to do with the number of advantage plans in the counties and the number of people who were on advantage plans. It's a very popular option in Minnesota. And it still remains so probably, but unfortunately for many of us, it's not available. So you keep original Medicare, Part A and Part B, and it is transportable in counties between counties, but there are only 21 counties where it's available in 2020. We'll take a look at those counties. I'm not going to read all of the counties, but you can see that none of the metro counties are involved, but there are many of the outstate counties that the cost plans are still available in 2020. And in order to determine if they'd be available in 2021, then that would be something that would be worthwhile checking into if you live in one of those counties that are listed. So I think we can, there we go, Medicare prescription drug D. Excuse me. Optional programs offered by private plans that provide Medicare prescription drug coverage. Plans that offer Part D include standalone prescription drug plans and the Advantage plans that we've been talking about. There is a monthly premium, and each plan has a formulary or list of drugs that it will cover. Now, I'm going to spend just a little bit of time on that formulary. Formulary is a tier of drugs. The best example would be that if there are normally five tiers, there's one company that has 6, but there are normally 5 tiers, and they begin with tier 1, which are the less expensive generics. They go to tier 2, which are generics plus some of the brand names, less expensive brand names. I should say tier 1 is generics. Then tier 2, tier 3 are the more expensive, and tier 4 and 5 are even the more expensive type of drugs that are usually that would be brand name drugs. I think you get to tier 5 and very often they are step drugs and that type of thing, but there are many drugs in that list. But they can put what drugs they want on the list as long as those drugs are okayed by the Center for Medicaid Services, because it has to include so many drugs in each category. So I think then we can talk a little bit more in detail about the drugs. Let's take a look at what the standard benefit is. The standard benefit is that your premium will vary, and that's something that you want to look into. You may or may not have a deductible. In 2020, the deductible is possibly $435. Some companies include that as the deductible. Some will reduce that deductible. And there may be some companies, and it very often depends on the premium that you pay, that have no deductible. So between the beginning cost of no deductible or a deductible, up to the cost of $9,038.75, which include your cost plus the company's plus the cost of the insurance company, pay 25%, and you pay 25% and they pay 75%. So what you have is you're paying 25%, they're paying 75% until you reach a total cost, you plus the companies, of $9,038.75. Then your co-pays are down to 5%, and the catastrophic benefit is 95%. Now this does not involve what is called low-income subsidy. And so we're going to talk a little bit about what is involved with low-income subsidy and what that is as we go along here. First, I want to talk about income-related adjustment amounts, or IRMA. Income-related adjustment amounts are based on tax filings. Now you can see in this chart that single tax filing is 2018 income for the year 2020. So it goes back 2 years, as is with joint. So if your income is under, if you are filing as single, $87,001, or your joint filing is $174,001, then your cost is $144,060. And your Part D cost is the plan premium. However, as we go down the chart, and we won't necessarily have to go through all of this, but if you go to the next level of $87,001 to $109,000, or $174,001 to $218,000, your monthly premium will go up another $57.80, and your Part D premium increases to another $12.20. So you're adding that on top. And you can see as you look at the chart, again, that as you go, when you reach that third level, you're actually doubling the cost. So it depends on your income, and it's a filing from 2 years previous. We can take a look now at some of the assistance for drugs. 2020 partial extra help for Part D low income subsidy. Now you can see in the chart, there's a thing that says your cost and the Part D cost. And again, green is your cost, and the Part D plan is the dark blue, I believe that is. So low income subsidy. Low income subsidy is through Social Security. If your income is within the guidelines, and I'll talk about that in a second here. If your income is within the guidelines, you will have lower premiums, and your deductibles will be on a sliding scale, and you will also be paying less for co-payments. So for the partial help income and asset guideline for 2020, if your income, and you are filing single, is $1,615 or less, or for a couple filing together, joint, $2,175, there is a $20 disregard, and your assets are $14,610 for a single person, or $29,160 for a couple, and that includes a $1,500 burial fund, then you may be eligible for partial extra help. And again, that's done through Social Security. You can get the forms through Social Security. You can get help for filling out the forms through the senior linkage line. But it's something for you to look at if you fall within those income guidelines. And they do change from year to year. Well, let's take a look at full extra help. And full extra help is, you'll notice with the partial extra help that there was a reduction in both your deductible and in your premiums, as well as your co-pays. But with full extra help, there are no premiums, no deductibles, and your co-pays are $1.30, $3.90, or $3.60 $895 to $895, which means that for wherever you would fit in that category, you would be paying no more than $8.95 for copays for your prescription drugs. And if you go over the $9,038.75, you plus the insurance company, your catastrophic benefit means that they pay 100%. Again, this is all follows the federal poverty guidelines, and there are no premiums if it's a benchmark plan. And a benchmark plan is determined through the Center for Medicaid Services, and there are lists of the benchmark plans available. No monthly cap on copays, no deductible, and no coinsurance. Now, the following dual eligible enrollees are deemed eligible automatically for full extra help. If you're on SSI and you're collecting Social Security, if you're on medical assistance, if the spend down is met once a calendar year, and medical assistance for employed persons, MAEPD, QMB, which is qualified Medicare beneficiary, SLMB, service limited Medicare beneficiary, and QI, qualified individual. And for people who are on elderly waiver or disability waivers like CADI, CADI, the BI, the CAC, and the DD. So these people are all automatically eligible, but your income, you would want to check into it and apply if necessary. So let's take a look at some of the cost, convenience, and coverage. When it comes to decisions, sometimes it's not the easiest thing to do, but so these are some guidelines when you're deciding. Option one, if you have original Medicare plus a Medigap policy. And I do want to mention that very often Medigap and supplement are interchangeable because Medigap was the original supplement. So the Medicare Advantage plan would not be called a supplement, but the Medigap plan would be. Higher premiums, lower out of costs and lower out of pocket costs. And keep that in mind that there are higher, for the most part, the premiums for Medigap plans are higher. Medicare covered benefits. You can use all Medicare providers without having to worry about network. And you can buy a standalone Part D plan. But underwriting outside of that 6-month Medigap period from the date that you are originally eligible for Medicare to that period of 6 months where you can join a Medigap plan. However, if it goes beyond that, then there might be additional underwriting necessary. Medicare health plans, which would be the Medicare Advantage plans primarily, and possibly cost plans, lower premium, higher out-of-pocket costs. So you might be paying less each month, but you will be paying more for the most part for your individual doctor and clinical visits, copays. But it does cover additional benefits. As we mentioned before, some cover hearing aid benefits, some will cover things like silver sneakers and other additional benefits. Most have what they're called a nurses hotline. Provider networks may require pre-approval or referrals, and they may include Medicare Part D. And we talked a little bit about the veterans and the eligibility of veterans, so you wouldn't need Medicare D. No health screening except for end-stage renal disease. And that is now, there is an end-stage renal disease is now not part of the underwriting at this point. All right, let's take a look at things to consider. Are you going to purchase a Medigap policy? If you're an original Medicare, do you need Part D? Are your prescription drugs covered by a creditable plan? We've discussed that. Can you afford the premiums? Do you have employer group health insurance coverage? So these are all things to consider. Medicare Advantage plan, Do your providers participate? And that can be checked into. Are your prescription drugs covered? And Medicare.gov and the senior linkage line can help you determine if your prescription drugs are covered by a plan. Coverage if you travel. Most of the Advantage plans have some type of emergency coverage if you travel, but if you're out of the state for a length of time and you have to go to a regular doctor's appointment, it may not be, you may have to pay more. Does the plan have extra benefits? And that's something to look at. And as Kirsch mentioned earlier, some plans that may depend on certain situations may even have more benefits than the normal plan would. Can you afford the premiums and cost sharing? In other words, can you afford the premium and the copay? So those are things to consider. We're going to take quick look here at how we can get help with Medicare costs. We talked about the Extra Help program through the Social Security Administration. Now let's take a look at Medicare savings plans, which are through the state, but they are administered by the county, by the social workers and financial workers in the county. Qualified individual, service limited Medicare beneficiary, and qualified Medicare beneficiary, or QMB. Now, Extra Help is included in those areas, and it will vary as to income, and the services provided vary as to where you qualify within each of those areas. So if you're QI, for example, you probably wouldn't qualify for anything but the $144 monthly premium being paid. Medical assistance. Now that's medical assistance with or without a spend down. And medical assistance spend down, I found out in helping some people that I've counseled in the past, can get to be a little bit complicated. So you will always want to make sure that you are in contact with the county financial worker or social worker with regard to that. And there is medical assistance for employed persons with disabilities, MAEPD, and that includes Extra Help once the spend down is met. So just keep that in mind, that Medicare costs, that you can get help with that, and if that is something that would work for you, you'll definitely want to check into it. And now I am going to turn it back over to Amanda to give us some more information on where to go for help.
So these are all of our resources that you can call for help. There's a lot of information when it comes to Medicare, enrollment periods, extra assistance, and we don't expect you to be able to do it on your own. So the Senior Linkage Line is here to help you. We have that number here, 800-333-243. But we also have a couple other resources that can help as well. We have our Disability Hub in Minnesota, the Veterans Linkage Line, the Medicare line, and also Medicare.gov. It has a plan finder and can really help you figure out the plan that is best for you. And also the Social Security Administration. So those are all great places to call for help. So if you do have any questions, please feel free to reach out. Again, that number at the Senior Linkage Line is 800-333-2433. We thank you for hanging in there with us today and taking in all this information on Medicare.